Hello, class. In today's video, we are going to be doing an interview with Young Ju, a professional in aging. Hi, Young.
Hello.
So just to get started, you all do have a copy of his bio on titanium, but we will start with a brief introduction. So Young, if you could go ahead and share your name, your profession, current employment and training, as well as any relevant identities that you would like to share.
Sure. Well, first of all, let me thank you for inviting me and the class. I appreciate the opportunity to be a part of this. So, as Aaron mentioned, my name is Young Ju. I'm the VP of Clinical Operations for CareMore Health. We are based out of Cerritos, California, and we are actually in 8 states across the country and continuing to grow. And we're a subsidiary of Anthem, which is a large health plan or insurance company that serves people across the United States. My background is actually in public health. I went to grad school at the Harvard School of Public Health almost 10 years ago, but I am originally from Southern California, and I went to UC Irvine, where I did my undergraduate degree in biology and Asian American studies. And so I'm a 1.5 generation Korean American. Grew up in the San Fernando Valley. What that means is my parents immigrated here. I was born in Korea. And my parents immigrated here when I was 2, so not quite second generation, but I'm the first in my family, in my immediate family, to go to college. And something I'm really proud of as well.
Thanks for sharing that. I know at Cal State Fullerton, I think the stat is somewhere like 50% or roughly around that much of our students are first generation college students as well. So a lot to identify with. So just to get started with your own individual journey, what do you do and why?
Sure. Let me answer the question by describing a little bit of my day-to-day responsibilities. At CareMore Health, as a company, we are like a medical group in some ways, where we're caring for patients who come see us, and we provide appointments to take care of any ailments that people might have. But we actually provide a lot of other kind of services, including hospitalists or physicians that go see patients of hours when they go to the hospital if they have a really severe event or an acute event, and they are at the ED or they end up being admitted. And what it really means is that as a team of clinical, non-clinical professionals, we come together to provide care so that we can prevent disease progression in patients, mainly the senior population, which is the biggest population we serve, but also to provide other kinds of behavioral health and social services and support that are needed. And so my responsibilities are actually to lead the teams that are running the clinics that we have across the country. And what that means is I have a frontline team of medical assistants who go through clinical training and administrative training in their programs. They greet patients, they help room them and do vitals. They do assessments to questions that would be helpful for the clinicians to determine what kind of care plan is ultimately needed. And in clinical operations, as my title describes, what it means is that we're not just interested in providing clinical care. I mean, you can spend hours and hours and hours with one patient and have a clinician spend as much time with them to address all the needs. But on an operational challenge, what we try to do is serve as many patients without sacrificing the clinical delivery of care. And so, it's sort of a business operations kind of role where I have to keep in mind, hey, we want to provide good clinical care, but not just for one individual, but how do we do it for as many people as possible with the resources that we have? So I work with our office managers, I work with our regional managers that oversee multiple clinics. And the way I like to describe it is, if you go into a McDonald's, you probably have gone to multiple McDonald's and you see the same kind of cheeseburger wherever you go, and you expect the same thing, ketchup, mustard, pickles, that sort of thing, and cheese on a cheeseburger. In healthcare, we're trying to do similar things in the sense that if you go to one of our clinics and see a clinician, we should be able to treat you with the same kind of best practices and clinical outcomes as you would no matter where you go, and you would have the same level of service that you would expect wherever you go. And that's not just a clinical challenge, because clinically there's usually some good best practices that everyone does, but keeping to the certain kinds of steps that you need to be consistent across the time and across whichever patient you see is a real challenge. And so that's kind of the business component of healthcare, and trying to make sure that everyone gets really high quality care, not just one person or unique sets of individuals.
And so can I follow up with a question of why are you doing this work?
Yeah, my journey actually, maybe it'd be interesting, it'd be helpful to share sort of my journey. My initial passion growing, exploring in college and beyond that was really knowing that I wanted to be in healthcare. My personal story is that I grew up, as I shared with you, in an immigrant family that ran a small business. We didn't grow up with health insurance. And so it was a pre-Affordable Care Act, Obamacare world years ago, where because we couldn't afford to have health insurance, and my parents ran their own small business and didn't purchase insurance directly, I often grew up fearful that I could hurt myself or be in a situation where I might bankrupt my family. And so any concerns, and I was an active, kid in my teens, playing football and basketball and sports, and but I found myself one day feeling, seeing something on my chest that was a little abnormal, and I got really concerned about it. And I, knowing that I could potentially need medical care, rather than telling my parents and rather than seeking care of a medical professional, it was sort of a growth coming out of my skin and chest that I decided to try to do my own self-surgery in the bathroom with a needle. And it's crazy to think about situations where someone would want to do that, but it's real. I mean, people who have wounds, and we see them all the time, people who have wounds but can't afford to go to the emergency department or go see a primary care physician, people who have cuts, and it can get worse and worse and worse because they fear what could happen financially. They wait until it's too late to do something about it. Fortunately for me, it turned out to be the bathroom surgery I conducted didn't turn out to be anything super serious, but it really motivated me to go into healthcare overall and serve people, from people who really needed the care the most. And so my life has really been dedicated to serving the most neediest populations and exploring where those populations are that need it the most. Access to care and people who don't have insurance was an area I worked on in policy for some time, and I did some work in community engagement with the Orange County Asian Pacific Community Alliance in Garden Grove, where I was an intern during college and then worked there part-time afterwards, and then led me to grad school and pursuing more work in public health. Being from a first-generation Asian American family, clinical medicine or something in that world could have been an easy step too. I think in speaking with folks and sort of doing some self-reflection, choosing a career where I knew I could impact a broader group of people was something that felt right to me. And as I continued down that path, it seemed like public health was the right fit for me. And along the way, I've found out that it's a good mix of doing policy advocacy work, a good way to impact multiple populations rather than one individual at a time. And then I discovered that when it comes to operations or project management, influencing multiple teams and getting teams to work together was something that I was passionate about, that I realized I was good at. And I've had to develop some other skills along the way. But that's kind of how I landed in clinical operations. I never imagined that I would be helping run clinics, and it was never part of my career journey. And actually, when I moved from Boston to take on this job at Caremore here in LA. Other than the nice weather and moving back to Southern California where I grew up, it was just being a part of a mission-oriented organization like Caremore that really drew me. But I actually didn't get hired on into this role. But it was my background in other kind of operations, other kind of management that helped set me up for success in this role. So that's kind of how I landed where I am today.
Thank you for sharing that, Young. I think it's really helpful to hear that journey and that perspective, how you've incorporated your own personal experiences with your education and a lot of the different skill sets that came out of that, not just knowing what public health is, but also learning the policy aspects, learning project management and how to run clinics like businesses, but not necessarily, more so in the way of being efficient rather than being focused on only the bottom line and not people. So yeah, I think there is at least one student in the class who mentioned that they're interested in health administration. And I know in talking to students here at Cal State Fullerton, more and more students are interested in that path. So thank you for sharing that. Other than the coincidence that it kind of goes along with your name, how did you end up working in the aging population or with the aging population?
Yeah, it's interesting. I don't think I would have been able to tell you 10 years ago that I'd be working with, the aging population, Medicare population. I went in with the mindset and sort of the one primary value driving my career decisions on serving the neediest populations. And you can define needy in a lot of different ways, but what became really apparent was that when you think about whether or not people can get care at the time that they need it, when they, where they need it, how they need it, you come back to two populations that really are the neediest, and you can define them multiple ways, but the aging population, as our bodies deteriorate, as other factors play into it, as we don't have easy access to clinical care or really comprehensive care, it became evident that it's a growing problem, and it's a growing issue and challenge that the United States faces, especially with the baby boomer population. And so it was kind of a discovery in understanding like what our biggest challenges are in the U.S. healthcare system, that the senior population became evident to me. The other population I would say would be kids and populations of low income that have very little financial flexibility to be able to access the kind of good care that they need. And there are, multiple segments, including people who suffer from behavioral health, mental health challenges, and so there are multiple things that people focus their career on. But for me, the senior population, the aging population, I honestly kind of fell into by opportunities. When I was in Boston, I mentioned briefly that I moved from Boston to LA. I actually spent 13 years in Boston even though I had only intended to stay there for a year or two, ended up being there for 13 years and suffering 13 winters there. But the opportunities to be a part of a movement at the federal level to create something called accountable care organizations and move from fee-for-service based healthcare where you get paid for every activity and visit that you have to really coordinating to get the best outcome for the patients was really focused at the federal level for the Medicare population. And as we might have covered in your class, that's because the government is the biggest insurance coverer of payments in the whole country, right? I mean, in covering Medicare costs of seniors and aging populations, a lot of the costs come at the end journey of your life, as opposed to in the middle when you're healthier, right? And so, for me, it became really compelling to think about how we were treating and providing care from a clinical perspective to patients that had chronic conditions like diabetes and chronic obstructive pulmonary disease, congestive heart failure, things that are actually preventative, but we have growing populations of people who continue to suffer from it. So it's been something that I've learned to love and appreciate, not just because of the vast challenge that the United States has overall, but because of the real big impact that you can have on the individuals as well as on the greater population that we're serving. So.
Awesome. Thank you for sharing. Definitely the things that you're talking about, the challenges align with this chapter's reading on aging and how, having more older adults than ever before with the chronic conditions and all of that leads to different needs as far as healthcare and different ways to take care of them, and not just from a clinical perspective, but also how can they age in place and still be part of the community. So it's wonderful to see what this actually means as far as a career and what
yeah.
are out
yeah,
there.
and, people joke about it, and I only kind of have to take it seriously, but with the large influx of the baby boomer population, it does provide a little bit of job security, that there's going to be that challenge out there. So it's funny to talk about that way, but it's a huge challenge for the country. So
yeah, and I think it does help to think about not only is it a challenge, but the payoff, not just financially, but it's rewarding to know that you can make a difference with addressing these community challenges. So thank you. So you did share a little bit about what you do in your role. Can you share a little bit more about what is the best part and what is the most challenging part? What does that actually look like?
Yeah. So the best part for me is, a lot of people expect that at a certain level. And I think early in my career, you have these perceptions of what it means to be at a management level role, or, and for me, title is only sort of a vehicle to help accomplish something, but I don't put my weight in my identity and value so much in being a vice president of clinical operations. And how that really bears fruit is that my mission is really still in making sure that the work that we do is impacting the patient on a day-to-day basis. So a lot of what I get to do is see how the work that my team and I do impacts patients, not just in one clinic, but in multiple clinics. And so I'm not just interested in being able to visit one clinic where we roll something out or improve something. I want to make sure that we're doing it consistently across multiple populations and multiple clinics. So I actually get to go out to the clinics quite often, and it's my favorite thing. I have to balance being in meetings and conference calls, but I am able to interact with patients and get their feedback, hear about their story, how we've impacted their lives. And it's not like I'm having deep conversations with them and I'm sitting for hours and hours and hours, where I could do that, but it's the very simplest things of seeing someone's eyes light up when I offer them a glass of water or some coffee, if I can offer them coffee in the waiting room. And they see, that I'm maybe in a shirt and tie, or they might see that I have a vice president title, but to me, the impact and the carrying forward of our mission is making it come alive, and knowing that, hey, I'm not here for you to come see me. I'm here to service you and provide the support that you need. And that's consistently my favorite part of the work that I do. And I go home and I tell my wife about my day, and it's the stories of being able to connect with patients and hearing about their stories, or where we failed them and where we needed to be, or things that just go above and beyond what is on paper in our job descriptions that really make it worth showing up to work and continuing to fight the good fight here. So that's consistently my favorite thing to do, and seeing and interacting with the patients. But it also comes with like the challenge, and I'll answer your question here by saying that the most consistently difficult thing is that my laundry list of challenges grows faster than I can actually address them. And part of the reason why is because the challenges are deep and require multiple teams to come together. It'd be one thing if I could just flip the switch and change something, but and more often than not, in any kind of setting, you're working with multiple teams that may not report directly to you, or you have to influence with some goodwill and buy-in and present what is a proposal and get their buy-in to support you. And so that takes time. It is you have to go through a very thoughtful process to do that. And it's not to say that you couldn't do things quickly even in that environment, but the biggest challenge is, and the frustration is, the laundry list of things that I would love to be able to do to make an impact on our patients, and then figuring out how to prioritize that. You know, my laundry list of things, hundreds and hundreds of pieces of feedback that I get from team members, from colleagues, from patients, from family members, include things like, you know, can we have better snacks in the waiting room? Can we be open on Saturdays? And can we have this type of equipment? And, you know, all those things are great ideas, but the challenge is, how do we get the biggest impact and prioritize the things we know are going to have the longest term impact, and try to tackle those as opposed to like you know, very small impact things that might have some role in care, but at the end of the day, you know, we want to make some longer term investments in making sure that the changes that we're bringing are actually fruitful, without having to continue to do them over and over. So hope that's helpful.
No, that is definitely helpful. Seeing both the highlights of the job. I think it's important to recognize that you are not a clinician, right?
Yeah, not a clinician, no.
You're not a clinician.
For any clinical advice, no.
Not a clinician, yet you still get to interact directly with patients from time to time, and still get their feedback, and actually maybe in some situations do more as a response, or do more in response to hearing what they have to say than some of the clinicians might be able to, as far as on a clinic-wide or company-wide level.
Right.
Yeah,
and I would say, just to piggyback, while I don't have the clinical knowledge and expertise to make any medication changes, right, and I wouldn't feel comfortable doing that, the really interesting intersection of where administrative and operations and business kind of come in with clinical teams is that if I were to provide a way to make it easy for our patients to pay for their medications, because now they don't have to pay anything out of pocket, it's more likely to have patients pick up their prescriptions and stick with them. And so while that's not a clinical decision, right, the clinical decision is, hey, be on metformin. If they can't afford to do it, and that's a lot of the times business and administrative decisions, if they can't afford to pick that up, then they're not going to stick to the medications, and then it affects their care. So administrators have a really big role in helping the clinical outcomes of a patient based on some of these kinds of decisions. Or even simply, if I were to give some kind of bag, something very simple, like give them a, like when we go to the Apple store or something like that, you might get a Apple store bag, right? And then it's reusable for other things. But if we had something like that that made it easy for patients to bring their medication in for their visit, it makes it easier for us to then help them manage that they are on the right medications too, right? So, and that's not a clinical decision, it's an operational thing that we're putting in place that influences the overall care of the patient. And so that to me is another really, really great part of being a part of clinical operations. You still get that clinical impact, but do it from an operational perspective as well.
Yeah, that's definitely a great example to help students visualize, like, what would that actually look like? What kind of decisions could a VP of clinical operations be making that would impact almost all the patients, right? And it was also helpful to hear from an administrator level perspective what some of the challenges are. You've been in the field for several years, and I'm sure that those challenges have changed as you have received more responsibilities and been in charge of more teams. So I think it is interesting that kind of throughout that process, it is kind of challenging to continue to work with people and persuade folks, and really it is a field where you don't work by yourself, and you need to have those people skills.
Right, absolutely. That's definitely one of the things in any role, not just unique to CareMore, or even if you don't work with clinicians directly, people have different interpretations of the same thing, and being able to work through that and work together with that is a really key skill set, and something that I continue to develop myself as a goal to develop further professionally as well. So I'm not quite where I think I could be in terms of that leadership skill.
Awesome. Well, on that note, my final question for you is, what advice would you give undergrads who are interested in this field? So may it be the field of working with older adults, or public health, or health administration, or clinical aspects of things. What's something that undergrads could start doing now?
Sure. I would say that there's two things that I would recommend. Number one, finding and being vulnerable and exposing yourself to as many mentors, formally or informally, as possible is really, really been formative. It's been such a great way for me to learn aspects of myself individually, as well as like helping me carve out my journey. And there are many mentors who I've come across who I call mentors, but they probably didn't consider themselves mentors. It could have been two separate coffee conversations, but it was really important in the way that it shaped how I thought about my values, my career, and even like next step decisions. It doesn't have to be, hey, this mentor really gave me career advice for 5 years or 10 years. It's maybe just trying to decide how I think through this next opportunity. But like if you weren't proactive about even seeking out those kinds of mentors, again, formally or informally, then you sort of sell yourself short. You kind of have only yourself to think about. And I think the more people you talk with, the more people you try to connect with, the more exposure you get to the changing dynamics of the world and the healthcare industry, the more context you have and the more information you have to make some decisions. And so I would recommend that really highly. And I'll just share my personal experiences that I've had. Probably, 9% of my quote unquote mentors have been informal, and only 10% have been really formal mentors. So I think that's probably typical. Most people don't have the time and dedication and commitment to be able to formally say, here's the structure and here's the mentorship that I'm going to get. But just because you don't have that doesn't necessarily mean that you can't be mentored. either from someone who's in the same industry or can provide their career advice. So, but the key message there is you have to be sort of proactive in seeking it out because they're not going to necessarily come to you for it. And then I think the secondary component to that, being proactive in seeking mentorship, is being really inquisitive and curious about everything. And I think standard practice that I would recommend in any situation, whether it's academic or professional or even getting to know someone, is to start off with asking a question. Just, you know, being able to start with the posture of asking a question as opposed to, you know, positioning yourself as the knowledge expert. Typically, when you end up going in with a predetermined view or a statement, you can lose sight of the broader context of something. And so I think if you orient yourself around asking questions and just being curious about the situation and asking really good questions and developing that, I think that is a skill set in itself. So I want to encourage everyone to develop that. But I think orienting yourself to curiosity and asking really good questions sets you up for a career where you're not closed off to any one thing. You can have as much information to gather to make the right decisions when you need to. So those are the two things that I would recommend. And I've personally benefited from that. I've benefited from that advice given to me as well. And I think in most cases, especially like if I'm hiring someone and recruiting a candidate in interviews, I'd rather someone be curious about a situation rather than feel like they have to say, hey, I've been through all the experiences and I know exactly what to do. And early on in your career and as an undergrad or even in graduate school, as you guys get more and more professional experience, you may not have as much experience to actually speak to, but if you're approaching a problem with curiosity and inquisitiveness, you can often talk through, okay, well, maybe this is how I would approach it. And so it sets you up for more success, because more often than not, like in my case, I have not gone through a lot of the things that I'm going through day to day, and I don't always have the answer. So I have to step back and start asking the questions that would be helpful for me to solve those problems. So.
Thank you. That's definitely wonderful advice, and not really always the type of guidance and feedback that students get when trying to think about careers, right? Taking the initiative to seek out those mentors, formal or informal, and just asking questions and being curious about each experience that you go into. So definitely appreciate that. Thank you.
And I'm happy to be an informal mentor, so you can obviously reach out to me, and I'll try to provide as much feedback as I can.
Awesome. So thank you for sharing your story. Are there any final words that you'd like to share?
No, I appreciate the opportunity to just even be able to share my story and my experience. I'm sure, part of this is to help pave the pathway for you all to be successful too. So I'd love to, even if we don't meet formally or get to know each other formally, I'm looking forward to all of your successes and the impact that you guys are going to have on the populations and the people that you're going to serve, hopefully in the healthcare arena as well. So.
Awesome. Thank you. I will stop the video here.